This is Roberto Carta of Kerstin Dental, and I'd like to welcome you back to the Implantology Talks, a series of interviews to some amazing digital dental masters. Before starting with this evening program, I'd like to thank the audience who watched for yesterday's interview with Dr. Scott Ganz. If you missed it or if you wish to review it, remember that the videos are available for 2 days. To watch the other interviews, please register to the link in the overlay window that you can see now. And with that, let's get started. Oh, I can see you there. Hi, Miguel. How do you feel tonight? How are you?
Hi, Roberto. I feel fantastic. It's good to see you again, my friend. It's never the same as if it's not in person, but you've been doing a great job at hosting this and just really, really good. Last night was fantastic.
It was fantastic. I agree, Miguel. And we have had a great response from yesterday's interview, and I'm very much looking forward to this second one on data acquisition and planning of surgical therapies. So over to you, Miguel, to introduce our guest.
Well, again, first of all, I'd like to really thank Kerstin for this incredible honor it is to allow me to interview some of the greatest minds out there. And it's just incredible. I'm really looking forward to the upcoming interviews. I think you've really handpicked a series of masters, and today's dynamic duo are an absolute example of this excellence. So for those that don't know the following couple, they are a father and daughter couple. They come from the center of the world, Rome, and I had the privilege of knowing them for many, many years. Each one of them in their own right is a leading dental surgeon, and they have the good fortune to be able to practice together. But ladies first, so I'll introduce my dear friend Fabrizia, who in her own right is got an impressive CV. So from graduating at the Sacro Cuore in Rome, went on to spend quite a long time at the UCLA, learning all about perio and implant dentistry. So very, very solid foundation almost a decade ago. So that's a very good initiation into the world of implant dentistry, and also an advanced postgraduate course in Sao Paulo, Brazil. And one of the most proficient digital dentists out there. I've had the privilege of sharing the stage with her, and she really holds her own. And it's wonderful to have such a powerful force. I don't like separating men and women in dentistry. I don't see the difference. I think the science and the work have to speak for itself. And I work a lot with young women myself at the White Clinic. And I always say, let the work do the talking. And quite frankly, Fabrizia, you've definitely earned a place on the global stage just for your commitment and your drive. And that leads me to introduce your father, who you know, if people know, graduated as a doctor back in 1980 and then specialized in stomatology, which is like the area of dentistry back then. But I think what kickstarted his career is to having spent many years in Gothenburg, the founding birth home of implant dentistry, having trained personally with Per-Ingvar Brannemark and his team, and then onwards being one of the founding fathers of not just Italian, but global digital dentistry, one of the founding fathers of the Digital Dentistry Society, with peer-reviewed published articles consistently year after year. But more importantly, a very humble educator, a very, very quiet a person. But when you get on stage, you unleash a lot of awesome knowledge. And to see the two of you together just makes me super happy. And I'm really looking forward to this chat, because you're just so humble, you're so gracious with your time, and you have such a wonderful practice in Rome. And I'm really looking forward to this. So I'm sorry to have taken so long to introduce you. It's just that sometimes I forget how awesome you are. But with that said, how would you like, what would the ideal introduction be to introduce you? What do you think would be, you know, how would you like people to introduce Fabrizia and Giuseppe Luongo?
Yes.
Me?
Yeah.
Okay. First of all, thank you, Miguel, for the amazing presentation. A lot of words and great words, and you know, I admire you and all your team in Portugal. You're also a mentor for me too. So, well, what I have to say. An easy presentation. Basically, I'm a dentist, an Italian dentist from Rome. I have to say from Naples, actually, because I was born in Naples, and my mom, you know, is very proud about this. So I need to say that my origin are from there. And basically, yeah, I have a huge passion that I still have now, that is surgery. And I started very early, you know, to follow this passion, and I was very lucky to have my father on my side. I decided first to go to US first and to see first what you know, what I was the word there. I was the things there in dentistry, and then I decided to come back actually to Italy to take some information and to, you know, to steal some important knowledge from my father too. So I started very early also to ask him to bring me inside the surgery world, with also maxillofacial surgery, so very complex cases. And then I realized that it was the thing that I actually love most. And yeah, I still have this huge passion, and I particularly specify myself in periodontics and also digital application in our profession. So yeah, that's it.
And Giuseppe, how would you introduce yourself, or how would you like to be introduced? What would you think would wrap it all up?
Well, you said more or less everything about me, but basically, yes, I am a medical doctor. I started learning general surgery, and so my whole passion has been surgery in all fields. And then my specialization in maxillofacial surgery. And at that time, we were used to remove implants, for example. This is something particular. The beginning of my career was removing failing implants. But during the 80s, we understood that something was changing. And I had the great opportunity to come to Sweden, as you remember it, and to be introduced to P.I. Bronemark and his team, and I started to work with implant. And at that time, the story changed completely. The implant was studied from a scientific point of view, and the story from that time began. And what I can say, my passion for digital solution, and especially for the possibility to have devices who could give to the surgeon, to the clinician, all the information to start with the treatment, with the correct treatment planning, started from those years, where for example, the implantology, the radiological equipments were very simple. And so I had the opportunity to follow all the progression of this kind of solutions, and the possibility of these new technologies. And having the opportunity to have my daughter in the team, and you know, for this new solution, especially for these impressive digital devices who can today do anything. You can have all the things that you need is extremely important for us. And so I add sometimes in my presentation I have slides from those years and cases, and it's extremely easy to see the difference of how today we can have all the necessary information to create a perfect treatment planning compared to those periods.
Do you think that the digital, I mean, first of all, it's commendable that throughout these last 30, 40 years almost, you've managed to consistently update your technology. I mean, you could have relaxed 10 years ago on your efforts, you know, one of the leading practices in Italy, and yet you consistently updated in technology. And do you think that Fabrizia was one of the driving forces behind that, wanting to allow her? Because I think that digital technology eliminates, in some areas, not all, the need for so much experience, because you get to see so much more with a CBCT, for example, than you would before having to do that. You'd have to rely on experience. Do you think that that's one of the reasons why you've invested so much in digital?
Yes, yes. This is I think it's extremely important. It's extremely important. It's totally a new way of having a relationship with your patients. You know perfectly this because you do things. Yeah, you have demonstrated that you can do things staying in.
And who's the boss? Who's the boss in that clinic? I think that's what everybody wants to know.
Who's the boss? Yeah, I cannot say that. The opposite. But it's true. I think that my help in digital devices may be forced to buy new stuff and
the first thing, yeah, when she came from US, the first thing he said, we have to buy a new CBCT, and I had already and I had one of 3 years before. And
you know, that's what I wanted to understand. So honestly, it's incredible to see your dynamic. How have you dealt with COVID? I mean, Italy was hit hard and fast and was unfortunately pioneering in that first wave. And Rome being quite north, how did you deal with it, and how are you dealing with it today?
Well, I think what we observed in our patient that if you are used to do everything, I could say slowly. Slowly means that you have to get exactly all the information, even if you need 2-3 hours to stay in front of your treatment plan. I think it's extremely important, as you are the father and the inventor of this concept, so you perfectly understand this thing. And I think when you do this routinely, probably nobody take care as in this period when your patients appreciated in a very clear way this moment. And now we are forced to have more time, because you know some of our activities actually are cancelled. But if you look into the team, the groups who are used to do this routinely, we did very small changes in our protocol. Everything was already done, and this is what we sometimes discuss.
Yeah.
While you were talking, I'm going to ask a question I don't think I've ever asked anybody, but it's always been there. Do you think that clinics like yours that have made that investment in digital technologies, because I've always said that usually in terms of workflow, the more technology you have, you're obliged to slow down, because it takes time to turn on the machine, to put in the patient file. It actually takes, in terms of the initial workflow, more time. Do you think that that's why clinics that have more digital technology have seen, let's say, a favorable outcome during the COVID pandemic, because they were already slowing down and thinking differently?
Yeah, I actually think that this could be one of the reasons why the digital clinic, dental clinic, are having more less problems in this period. You know, this is what we actually showed since the beginning. We were actually surprised by the fact that all the rules that came, you know, from the government were actually the same rules that we always used. So we just, you know, add some little things that, you know, for the waiting area maybe, but yeah, more or less we had the same things. And of course, the digital devices helped us also to be, you know, less in contact with people, because everything is digital, so we can communicate better without, you know, passing things, tools, or
no paper,
white screen and everything on it. So we actually didn't have these problems.
We can just make a single visit in which we get all the information, and then you can send to the patients on his iPhone, on his tablet, the treatment planning, and you can decide which is
discuss
the best one,
phone.
and then you can see him just for the treatment.
So one last question there. Do you think that in such a competitive environment, I mean, we're both working in Southern European countries. We know they're very, mostly privately owned businesses, very competitive environments. Do you think that the COVID pandemic, you know me, I always like to find something positive in anything. It's just part of my character because we're dentists. We have to find beauty in horror. So do you think that this pandemic has somehow filtered those that pre-COVID had invested in safety and security and digital and protocols? Do you think that now this has actually been a filter system, and have you identified that in your region, for example?
Yes, for sure. It's evident, and I think that all the team and the clinic and the people who invested in this thing in the past 5 years, I think, as a different pattern with the patients. There are some offices that are more or less closed actually, while the one who have this kind of technology have invested in these things have more or less the same pattern than in the past, and this is extremely evident.
So the one with the Ferrari, but that was still using paper and traditional X-rays, is now probably having to sell the Ferrari. Anyway, so that was a wonderful introduction, and I'd like now to go to the second part of this, and I'm going to get a little bit more technical. And since we were discussing about this first appointment in data acquisition, that's a great way to pivot into my first question for you, Professor Luongo, or Giuseppe. We are friends. What are the most important aspects for you during the 3D acquisition of patient images?
Well, the most important aspect is to take care of the small details. First of all, you have to have a great equipment. In terms of quality, I mean. Today the CBCT is sold from many companies. Sometimes you can find on the market very cheap devices, and the quality of those are really bad. And when you come into details like a guided surgery, where even 1 millimeter is extremely important, you have to start with a very good quality equipment first. Second, you have to follow all the details. For example, when your patient is under the device taking the examination, it's extremely important that you follow if it's stable, is in a correct position, because 40% of the mistakes comes from this single starting point. And so I think that you have to have the experience. When we started many years ago with this kind of technology, these technologies were not in our offices because it was too complicated. You have to send your patient to the radiologist, and at that time we came to the radiologist with the patients, because we want to be sure that the radiology started with the correct point. Otherwise, at the end of the story, you can add only mistakes, and when you put your implant, is in a completely different position than you expect. I think this is the most important thing.
Just out of curiosity, when was the first time you did a guided surgery?
Exactly, navigation, 1996, and stent guided surgery around 3-4 years later.
It's illegal to practice. It's illegal to practice until you finish medical school.
You can imagine what kind of problem we had at that time.
So that's a great thing for my second question, which is, has guided surgery planning really improved its reliability over the last 20 years? And you really can. We're not saying 20. So 1996 till now, we're looking at 26 years. So has it really improved the reliability? And if so, how?
Yeah, absolutely, yes. At the beginning, the CBCT started in 1993, 95, and the idea started in Italy from a group from Verona, and we was involved in the first use of this technology. Before that, we had the TC, where the dental scan was the software we used. And basically, the great improvement is to combine this information with a software. And a software we can manage different other aspects. And also the possibility to use the files, the information that comes from these devices to be introduced in different software where everything can be matched. And so the great improvement in these years, especially in the last 10 years, is to have everything in just one place where you can have your virtual patients and make all the different, try all the different options of the treatment.
I'd have to agree. I think that the simplicity, which now we can just, first of all, I think also the evolution of the internet and file sharing, so even companies that have nothing to do with dentistry, from Dropbox to Google and all of these that help to share very heavy files, DICOM files and STL files. I think that this really has been quite a revolution. And what are your choices?
We have seen you have treated a patient in the middle of Africa, stay with this kind of technology. We have.
So I wanted to prove a point, and that was with CareStream. Will be happy to know with the CareStream scanner. So, what are your points? I mean, both of you were founding members of the Digital Dentistry Society, right? So you're both very active ambassadors, and you're the past president of the Digital Dentistry Society. I'm also very honored to be on the board. I'll never forget your gracious invitation in 2015. And this means that you guys aren't just normal digital dentists. You actually get to see and know more about digital technologies and companies because you're sitting on the board of the world's foremost society for digital dentistry, with now embassies in almost every major capital around the world and growing rapidly. So your opinion isn't just based on your own experience, but it's compounded by, all of the lecture circuit that you've done around the world consistently and over, many, many years, and also the fact that you sit on the board of this society. So my question is, what do you think about the evolution of guided surgery softwares just in the last 5 years?
Well, the evolution is great as any kind of software. In the last 5 years, the software are actually able to be extremely more, I'd say, open to different sources, and the modern software are actually integrated in some kind of devices or can easily speak with some devices. I think this is the most important thing, because there are systems that are closed from the beginning to the end, and not in this way you are forced to buy all the chain, all the things from the beginning to the others. While there are some software actually that have a particular focus on some aspect, sometimes you need to know different things, because we think on implants, but we have to think to many other pathologies of our patients. So sometimes it's extremely important that the software can be integrated with other information coming from different sources.
And we definitely see that open source technologies are just winning completely that battle. And Fabrizia, a last question for you before you're going to show, I believe, something that will inspire us all. How do you think these softwares can be improved? What are you looking forward to seeing in the future? I know you spend a lot of time planning. I've seen you plan cases. I've seen how you discuss this. What do you think should be improved, could be improved, and what are you looking forward to happening?
Well, I think that the future development of these digital technologies will be basically based on two steps. The first step, I think it will be to become more and more open. So I'm saying that this and repeating this because I actually, when I started, I was dealing with all this, incomprehension, this misunderstanding between all the sources. So most of the time, the clinician spend a lot of time and waste time, in front of a computer, exporting and importing data. So the first thing, I think it will be to be, of course, more open. And then I think I'm expecting something from, the artificial intelligence, for example. So I am, dreaming about in some way an artificial intelligence that can help us in order to do all this step of the digital workflow itself, and maybe leave to us only, the last check. So matching the information, cleaning the images, even starting to plan and to insert and to suggest us the correct placement of our implants, for example, and then give to us an entire and complete reconstruct virtual patient with face scanner, intraoral scanner matched with, anatomic files and data. So yeah, I think that I hope that this will be, the future, to have more help from these digital technologies.
I think that you've hit it on the nail, and I would have to agree with you. It's inevitable that you've just described the future. That's not a wish. I think it's a prediction, and it shows. I think there's that saying, when you've got if you fill a room with monkeys working on a typewriter, sooner or later one of them will write parts of Shakespeare's work. So there's a bunch of not monkeys, very clever dentists, all asking for the same thing. And that's one of the beauties of the Digital Dentistry Society, because you see, just even in the expo area, that across the room, guys that usually wouldn't meet start meeting, and that's where the magic starts happening behind the scenes. So I think that that's definitely something that's going to be happening. I would just suggest that anybody listening to this and that's programming the artificial intelligence, that they make certain that they program it benignly. So, because there's a lot of lack of ethics in our profession, and if you make everything a bit too easy and you cut certain milestones out of it, anybody with money and the capacity to get patients to accept treatment plans can then execute. And I think that's going to be a good thing, but you have to have these milestones. And I think that societies like ours, the Digital Dentistry Society, and other ones definitely need to make sure that they implement ethical milestones. And I'm sure Carestream Dental, I've met some of the hardworking men and women that are in the programming section. I know you'll be talking to Guillermo in a bit, but these guys are all usually very good, positive and ethically guided people. So I know that we have to communicate with companies that this dream that you have, Fabrizia, does come true in an ethical and biologically driven fashion. So with that said, let's jump straight to your case, because I can't wait to see it.
Yeah, thanks, Miguel. So yeah, let me introduce to you just a case that I would like to explain in order to show you how we use digital devices in our daily practice for routine cases like this. So this is a patient that actually came in our office with a severe periodontitis, so a very complex condition of inflammation and poor compliance, of course, at home, and also economic limits. So we started, of course, from this point, and we started, of course, from our diagnosis. At this point, I only want to show you how we every day match our modern digital softwares with our traditional and conventional system of diagnosis. So basically, we always use digital photography, of course, our advanced beam computer tomography, digital x-rays, but also matching this information with, for example, an easy and simple probing that, in my opinion, is extremely important to check the first condition, the first situation of our patient. So Basically, these were the situations of the natural dentition of our patient with our intraoral photography. We did, of course, our bidimensional analysis, X-ray analysis, and as you can see, we matched this with a simple probing, and you can easily check the extremely severe condition of periodontitis in the upper jaw, so a very high grade of mobility of this teeth and a very severe inflammation. So we also use the external, of course, digital photography to analyze the proportion and maybe applying some virtual teeth in order to see the space that we can use, the space that we have in our hand in order to prepare a correct, result and a correct smile for our patient. And most of the time we always use an intraoral scanner even at the first visit in order to create a storage, an easy storage with the use of an optical impression. So we, in this case, decided to start with the extraction of the hopeless teeth, and of course we decided to wait after 40-60 days before starting with our surgical procedure. During these days, our patient actually wore these provisional prostheses, removable prostheses, and this was the starting point of our protocol for guided surgery procedure. And you know that there is a typical protocol that is called double scan technique. So we use the same prostheses, we apply some reference point, as you can see, and we create an index in order to stabilize the stent during the CBCT examination. So as you can see, the patient bites on this index in order to be in the correct position, and this is what happened with our CBCT. So we always do this double scan technique for total edentulous cases. So one with the patient wearing this stent and one of the stent itself. And then, as I said before, we need to export this information. So this is the reconstruction, the virtual reconstruction of the two CBCT. And then these are the DICOM file, of course. So an open, an open file that we can move easily with inside our software for digital plan. Actually, nowadays, Carestream has also the possibility to plan in its software already with the use of library, of implants library, some an idea of the implant placement, and also to immediately communicate to our patient the solution, the best solution. So this is what happened in the modern software. So basically we see in advance in the same window, everything. So the, of course, bone, but also the possibility to match this information with the prosthetic result that we want to achieve for our patient, and decide the correct, in particular, emergence profile, having in mind the aesthetic result that we want to achieve. So as you can see, in case of total edentulism, we need to stabilize the stent before starting the surgery. So we decided to insert this fixation pin. We always decide to insert these pins in the vestibular part, avoiding when we can the palatal side. And this is the virtual, reconstruction of our plan, of our idea of what we can, have as a proposed to our patient. So 6 implants in the upper jaw, and as you can see from the occlusal point of view, we had the opportunity to have a correct emergence profile in terms of aesthetic also result. So this is what I was talking about. So the possibility to use these digital devices also to communicate with our patient and to make him part of the decision, I would say. So make him part and understand what we are proposing and actually why this could be the first solution for him. So after the confirmation from our patient, we order our stent. So we receive this stent, the surgical stent in our office, and also, of course, the printed model if you want. And now the technician is the one that can work on the virtual world in order to produce, to model the aesthetic result, but also actually the prosthesis that we want to deliver, if we can, right after the surgery, if we want to do an immediate delivery result at the end of our implant placement. So this is the framework that he modeled and that he realized that he milled right from the digital file, the virtual file. This is the surgical part. Of course, we start also here to stabilize the stent with the use of an index that can be printed or can be, you know, a traditional silicone index. Basically, we insert our fixation pin and we prepare one by one each side with the use of the correct drilling sequence without removing the stent from the beginning till the end of the implant insertion. So this is why we try to, you know, irrigate as much as we can in order to push the water under the irrigation under the stent, of course, in this step that is a flapless procedure. So this is the end of the surgery, and basically, as you can see, when we remove the fixation pin, we find this type of situation, so very mini invasive technique in this case, that we applied, of course, our abutment because the primary stability was okay. And then another thing that we can actually have as a positive, thing from these technologies is that nowadays we can also use, for example, intraoral scanner in order to measure and to analyze the accuracy of our technique, of our procedure, without the use of a second CBCT. So this is also a revolution that actually came in our profession, even in the research field. We overlap the two files, the two data, and we study the difference in terms of position of the real position of the implant comparing with the one we planned. So this is the prosthesis. We delivered the prosthesis right after the surgery. Of course, the prosthesis was reliant. And this is the X-ray at the end of our procedure with the prosthesis, the smile of the patient at the end of the surgery. This is the follow-up at 3 months. And of course, we are still following the case. This is 1 year follow-up. And here you can see another application of digital technologies in order to check the balance of the occlusion that actually we know is a critical point in the long-term maintenance of our results. And this is the smile of the patient at the end of the surgery. So in a very, I would say minutes, hour, we deliver to our patient this result, starting from a very, hard condition, severe condition of inflammation. So
that was amazing. And before I pass you to Roberto, I just like to say that there's no way you could, you said one thing at the end of the introduction of the patient, which was, limited financial capacity, and I think that one of the things that a lot of dentists or because you are private business owners, it's like we're small business owners and time is very valuable. So it's not just so much you delivered a very complex case, but you managed, I'm not talking about the time behind the computer but I'm actually chair time, which is very valuable. You managed to do a complex case quite fast, and I don't think you could ever have done this complexity and as efficiently with such reduced chair time if you didn't have the CBCT and the iOS scanner and the know-how. So amazing, congratulations. Roberto, over to you.
Thank you, Miguel. I love the discussion before the case. It was a very beautiful case. It's what I always appreciate, that the smile of the patient, you see, you didn't remove also the diastema. You kept the original smile of the patient. That's
Roberto,
very nice.
Also, I arguably very ethical, because those were definitely terminal dentition. There was no way those teeth could be saved. And one thing I love about Fabrizia and Giuseppe's work, and I've been following it for a long time, they will never extract a healthy tooth to place an implant. And that's something that I really do from an ethical perspective. you see all these clinics popping up, and they're ripping out healthy roots to put in implants, you know, with or without digital technology. I just think that you know, there's a bunch of very ethical dentists out there, and that was probably one of the hidden things about this case, you know, that you really helped this gentleman with hopeless dentition, and I do commend you.
Good. So let me introduce you to my colleague, Guillermo La Rosa, who is the product manager for the Carson Dental Imaging software in the EMEA region. I can see you joined us, Guillermo. How are you?
Okay, very well. Thank you, Roberto. And I'm very honored to participate in this top class event. So thank you for inviting me.
You're welcome. So I understand that you have a couple of questions for our guest tonight, right?
Of course, yes, I do. That's very interesting. And okay, so the first one is for Dr. Fabrizia. So just straight to the, I'm cautious about the time, so straight to the question. So how important is the image quality of the CBCT unit for you? And what is the resolution you think is the best for your daily work? And linked to this, how intuitive you think should be a software like the CS3D imaging that I know you are using for your team at your practice?
Yeah, well, thanks for the great question. Basically, I think that the quality images of our first data for the diagnosis is extremely important. It's one of the critical point of the first visit, and the quality needs to be enough, needs to be high. First, for the correct diagnosis, you know, to compare something that could be a neoformation, you know, in a negative way, to something that actually could be treated in a different way. So basically, the quality of images needs to be high, and I would say that in my experience, the resolution that we usually use for our diagnosis is in terms of 150 microns, and but I would say that when I can, I really like to have even you know, higher resolution, like 75, with difference, of course, field of view, I would say, because the modern CBCT can allow me nowadays to change completely the type of exam that I can do. Basically, I can, you know, have the variation from 5/5 until you know, 17/13, so very high and very big field of view. And of course, I also need to say, as the third answer, that a very positive thing that I am experiencing nowadays with the new CBCT, the one that we have today, is also the possibility to have an help in terms of minimize the you know, the artifact that always have with our patients, because we always are treating patients that maybe had, you know, different type of restorations, or maybe implants, other implants, or so nowadays we have the CBCT that has some algorithms, so that's divided, that cancel completely or reduce at least this type of artifact.
Yeah, very well pointed, Fabrizia. So indeed, yeah, you said this 75 is the right resolution for high image quality needed, depending on the field of view as well. I mean, when you are in a small area, of course, and for example, is also important in endodontics treatment, because I mean, you know that the periodontal ligament is around 200 microns average, so you need minimum 100 microns to see that. And on top of that, with the latest equipment that I think is a CS96000, am I right? That you have it in Verona, if you have a second place. You didn't tell that during the interview.
Yeah, it's a new thing that we are experiencing, until recently. So of course we received this this amazing CVCT that I'm working with, and I think that also Miguel has in his office. So it's amazing. So having all integrated in the same machine.
We are waiting to have installed also in Rome.
Yeah,
soon.
of course, because I cannot stay without it.
Without a doubt, it's without a doubt a very, very powerful and unique machine.
So then, they have a unique live MAR metal artifact reduction display with this software, with 3D imaging software. That is, okay, of course, a great help. So I know I'm running a bit out of my time, but I have a second topic for Dr. Giuseppe, but you already answered it. So then my work is easier. So because it was related about what do you prefer, if you need a 360 degrees diagnosis software solution, and out there is two possibilities. It's an end-to-end solution from just one provider, or then an open solution that you can mix different softwares. You already said open. You already said that you are preferring that because you are using that in your daily life. Therefore, can you tell us a bit more of your personal experience on choosing this open solution?
Yes, at the beginning of the story, I think most of the companies were afraid that the flow chart, starting from the beginning, could be, in some way became wrong during the steps. So probably they tried to have everything in the same step. But since the beginning, even personally, but also with the society, with the Digital Dentistry Society, we try to force the company to have to be open to their information, because I think it's extremely easier to in our daily practice. We need information sometimes from different sources. So if the systems are open for the clinician, it's extremely easier to have the possibility to introduce different information from other sources that can be used in the same software. So our experience started with this, and it's also extremely easier for the clinician not to have an informatic on his side every time to try to understand all these different languages. I think the more the systems are open, I think the more the general practitioner can start with in an easier way with digital technologies.
Yeah, absolutely. So thanks, Giuseppe. Of course, I mean, that's why I asked, that our newest CS Imaging 8 version can do just what you said. So it's providing all the needed diagnostic tools and export possibilities, import possibilities with a very useful and easy to use, intuitive user interface. So that means you don't need to be an IT expert. So thank you for all of you three for your confidence in our products. And then back to you, Roberto.
Thank you, Guillermo. Thanks a lot for your questions. Please stay with us. And now back to you, Miguel, for the final part of the interview.
All right. Well, thank you so much, Roberto. Honestly, just to compound what Giuseppe was saying, the noise reduction, so that metal artifact reduction technology on the CS9600 really is a game changer. And based on all the answers that you've been giving, the quality of the image in order to do complex treatment planning is essential. And more we're finding patients that have old implants or a lot of metal artifacts in their mouths, and that software truly is a sign of the times and showing that this company knows what they're doing. So with that said, I don't know if you know, but at the end of last year, Carestream ordered a survey. Now this survey was quite groundbreaking because it wasn't done to dentists, it was done to the general population, and they surveyed over 7,000 nationally representative adults across 7 global markets. And they had some very interesting results. I actually met with Carestream in the midwinter, and we spoke about this, and I found the whole thing fascinating, and you have to find this study. But Fabrizia, check this out. 2 out of 3 patients would consider changing to a dentist who uses more advanced technology. That's actually one of the findings. Can you comment on this?
Well, I think it's understandable. I mean, and I have to say that it's easy to have patients in our office that, you know, are enthusiastic about the communication that we use with these digital devices. So I think that a patient that can experience the way that a clinician present, for example, a treatment, an option to him with the use of these devices, with the study behind the scenes, I would say, you know, without the patient, every time we match information and we study in advance what we want to show to him. So I think he can tell every time that he see a clinic, like a clinic that use these technologies, that the clinicians spend a lot of time studying all the data, you know. So it's easy to understand why a patient can be attracted to this type of modern clinic. I always see, you know, mothers that comes here for orthodontic treatment, and we always, you know, show to them this intraoral scanner, this you know, the movement of the mouth of his child, and they are impressed. They are impressed, and they always, you know, take picture of the screen. They send to the father, oh, look, this treatment. So it's unbelievable how the technology can, you know, speak for us, and can, you know, rise and yeah, speak. I think speak louder than us, you know. Can
absolutely wonderful answer. And you show that in your presentation, you showing your iPad to the patient, and, you know, including him in the treatment planning process. I always say technology allows you to turn your patient into a partner, not into a client.
Yeah.
Because clients, you know, whenever if they're a client and there's a problem, it's a problem. If they're a partner and there's a problem, there's a solution. And that's what I think this technology does. And I'm so happy you just got the new 9600. Make sure what we're doing, and we've been doing for the last, you know, years, is that they start with that, and we spend a good amount of time looking at the CBCT, because they do that 3D rendering, which is fantastic, before we even take them to the dental chair. So before the patient even goes to sit in the chair to talk about their problems, we've already seen the CBCT together. And whatever they think they've came for changes. And it really sets the stage. It's an amazing, amazing tool. So Giuseppe, would you agree, based on this understanding, that now more than ever, investing in digital technologies is key for the practices in the future? And feel free to answer this as the former president and one of the founding members of the Digital Dentistry Society.
Yeah, absolutely, yes. I today, if I think the old way of doing a treatment planning, everything was in your hand, and when you went in front of your patient, explaining what you want to do just on a piece of paper, trying to make you understandable for him, is totally different than today. Today, you can show exactly what you are doing, what are the options. And if you need, for example, a treatment, grafting treatment before, it's easily to explain to him, here, this is your CBCT, you have a hole here, you don't have bone. So it's absolutely, extremely, I think, impossible today. I think it's impossible today without living without these technologies.
And I just wanted to, just one last thing, because as you were very gracious to mention, you know, as one of the founders of the slow dentistry movement, which Carestream Dental has been so gracious to let us be a part of and sponsor this. I think that a lot of there's this misguided conception that the acquisition of these technologies actually save time from a management perspective. And the consensus from all of the doctors that we've been talking to is, and we discussed this a little bit in the beginning, but it's one of your feelings on this, that this actually does make you slow down and include the patient. And that's one of the things that is one of the founding cornerstones of slow dentistry, which is take time to explain things to your patient. So do you think that technology, these technologies, iOS scanners, CBCTs, these beautiful technologies we have, improve that communication and also help reduce stress and stress for us doctors, for our team, by bringing so much more light and clarity than the traditional methods of analog digital, just a simple impression? Or do you think that this is something that is positive in that patient communication experience and mitigating complications down the line?
Yeah, of course. And in particular, also, as you said, being slow and have the time to, communicate with all these devices to our patient, give us also the time to better think about our treatment solution. So, sometimes I think that with the analogic, traditional way of communicate, we are forced to say, at the first time what we want for him and what we can offer to him. But with the use of this technology, we can be slow, actually. We can think more, we can see better with this amazing high quality images. So everything is easier for us, and we can save time to better analyze our cases.
Less stress everywhere. Less stress everywhere. So we're all looking for at the end of the day.
I could also add to that it's also today, I think it's also from being slow and using this kind of technology, I think it's more ethical for our treatment in front of our patients. I think today, I don't think it's ethical to approach a case, especially complicated cases, without having collected perfectly this kind of information. I don't think today you can start with the surgery not having clear what you will find when you open a flap.
I think that very soon what you just said is going to be a rule around the world, and we'll make sure that is something that the people understand, that it's a basic human right that the doctor has seen a CBCT prior to any complex bone surgery involving implants or not. I want to thank you so much for your vision, your kindness, your generosity. I miss hugging you guys on stage, and I'm sure you don't stop doing what you're doing, but I'm sure you're collecting a lot of awesome cases. And anybody watching, stay tuned to Dr. Fabrizia and Professor Giuseppe Luongo and their wonderful work. Roberto, back to you, my friend.
Thank you, Miguel. Thank you, Giuseppe. Thank you, Fabrizia. It was fantastic. Also, thanks to Guillermo. It was a wonderful topic, very enriching listening to your discussion. And also, I'd like to say thank you to the audience for your participation and questions. Let me remind you to please register to see the remaining interviews. And tomorrow night topic will be new strategies for implant-guided surgery with Dr. Jafar Mouy. Good night, and please stay safe.
Thank you. Thank you so much.
Thank you.
Thank you.
Thank you.